Look at your nails right now. Hold your hand up. Natural light if you can, not a lamp, actual daylight. Look at each finger slowly. I want you to look for one specific thing first. A dark line. A thin, vertical, dark streak running from the base of the nail toward the tip. Brown or black. Could be in just one nail. Could look like a splinter that never came out. Do you see anything like that?
Because if you do, I need you to stay with me for the next few minutes. That line has a name. It has a cause. And in a small but significant number of people, it's the only visible sign of something that needs to be found as soon as possible. I've been practicing medicine for a long time, and the thing that keeps me up at night isn't the dramatic emergencies. Those announce themselves. It's the quiet signs, the ones sitting in plain sight that nobody looked at. The ones people saw every day for 2 years and assumed were nothing. Your nails are not nothing. They're a reporting system. And today, I'm going to show you how to read the report. Let me start with that dark line, because I don't want to leave you sitting with that question unanswered. The medical term is melanonychia, a dark, longitudinal streak in the nail, brown, dark brown, or black, running vertically from the nail base toward the tip. Now, here's the first thing I need to say clearly. Most dark nail lines are benign. They're caused by increased melanin pigmentation in the nail matrix, often from minor trauma, from certain medications including some chemotherapy drugs and antimalarials, from hormonal changes, or simply from genetic factors that are more common in people with darker skin tones. Many people of African, Asian, and Hispanic descent have these lines throughout their lives, and they mean nothing at all. But a dark, vertical line that appears for the first time in someone over 60, with no prior history of it, particularly in a light-skinned person, that has to be evaluated. Because subungual melanoma, melanoma originating under the nail, is real, it is underdiagnosed, and a dark streak in the nail is frequently its only visible sign until it's progressed significantly. What distinguishes a concerning line from a benign one? Width matters. A streak wider than 3 millimeters deserves attention. If the dark color is bleeding out onto the skin around the nail fold, what dermatologists call Hutchinson's sign, that is a red flag. If the streak has changed in width or darkness over the past few months, that matters. If it's in the thumb or big toe specifically, the most common sites for subungual melanoma, the threshold for evaluation should be lower. I had a patient, I'll call him Raymond, 69 years old, retired contractor, not someone who spent much time thinking about his nails. His daughter noticed it during a family visit, a dark streak on his right thumbnail that had apparently been there for about 8 months. He'd assumed it was a bruise from work that was slowly growing out. It wasn't a bruise. It wasn't growing out. It was widening. Subungual melanoma, caught at a stage where treatment was straightforward and the outcome was excellent. Because his daughter looked. Because she asked. Because he came in. He almost didn't come in. If you have a dark line in any nail that you cannot clearly attribute to a trauma that happened in the last few weeks, please show it to a dermatologist. Not next year. Soon. This is a 5-minute examination. It is the kind of thing that takes almost no time to evaluate and potentially changes everything. Now, look at the shape of your nails. Not the color. The shape. Look at your fingertips in profile. Hold a finger sideways and look at the angle where the nail meets the fingertip. In a normal nail, there's a slight downward angle. The nail curves gently over the top of the finger. The fingertip itself is relatively flat. Now look carefully at the very tip of the finger itself. Is it the same width it's always been? Or does it look slightly enlarged, rounded, almost bulbous, like the tip of a drumstick? This change is called clubbing, and it develops so slowly, over months, sometimes years, that most people don't notice it in their own hands until someone else points it out, or until they see an old photograph and compare. Here's the quick test. Place the nails of the same finger from both hands back to back, fingernail against fingernail, facing each other. In a normal finger, this creates a small diamond-shaped gap at the base of the nails. You should be able to see light through it. If that gap has disappeared, if the nail bases press flat against each other with no space between, that is called Shamroth's sign, and it is one of the most reliable indicators of nail clubbing. Now, why does this matter? Clubbing develops because of a specific physiological change in the tissue at the fingertips. The mechanism is not completely understood even now, but what is consistent across decades of clinical observation is what conditions produce it. Chronic low oxygen delivery to the peripheral tissues, lung conditions, particularly pulmonary fibrosis, lung cancer, bronchiectasis, that reduce oxygen exchange. Some forms of heart disease, particularly those present since birth or those causing chronic reduced cardiac output. Certain inflammatory bowel conditions in severe cases. Liver disease in advanced stages. Clubbing is not subtle when you know what you're looking for, and it is not explained by age. If you perform Shamroth's test right now and find that the diamond gap is absent, if your nail bases press together completely flat, please bring that finding to your doctor and ask specifically whether clubbing is present and what evaluation is appropriate. I want to give you a moment here before we move on. Check both hands, do the test. Take your time, because the next sign I'm about to describe is the one that surprised my patients most. Not because it's dramatic, but because it's so common that almost everyone has it, and almost no one knows what it actually means. Spoon nails. Look at the surface of your nails again. Does any nail look slightly concave, curved inward rather than outward? Not dramatically hollow, like a bowl. Just a subtle inward curve instead of the gentle outward dome that a healthy nail should have. In a pronounced case, you can actually balance a drop of water in the nail without it rolling off. This shape has a medical name, koilonychia, and it develops when the nail matrix is receiving insufficient iron for a sustained period. Iron is essential for nail cell production. The nail matrix generates new cells continuously, and those cells require iron to grow with proper structural integrity. When iron levels drop, not just slightly but consistently over time, the nail cells grow softer, more flexible, and under the pressure of surrounding tissue they curl inward instead of outward. The shape itself is the body's record of iron deficiency. Visible, fingertip accessible, available for anyone to see if they're looking. Now, here's what I want you to understand about iron deficiency after 60, because this is where the conversation goes, somewhere people don't expect. Low iron is not always about diet. In younger women, it's often about menstruation. In older adults, men and women both, when iron is genuinely low and diet seems adequate, the first question I ask is not, "Are you eating enough red meat?" The first question is, where is the iron going? Because iron doesn't just disappear. If you're losing it, there's a source. And in people over 60, one of the most important sources of slow iron loss is bleeding somewhere in the gastrointestinal tract. An ulcer, a polyp. In some cases, a colon cancer that has been bleeding slowly. Not dramatically, not visibly, but consistently enough to drain iron stores over months. Spoon-shaped nails, persistent fatigue, and iron deficiency that doesn't fully correct with supplementation. That combination is a referral to gastroenterology in my practice. Every time. I think about a patient I'll call Harriet. 73, very organized woman, kept meticulous track of her health. She'd been taking iron supplements for almost a year because her doctor had found her iron low. It improved modestly but never normalized. She mentioned in passing that her nails had always been soft and a little curved. She thought it was just how her nails grew. She had a polyp in her ascending colon that had been bleeding intermittently. Non-cancerous as it turned out, but the kind that becomes something else if it's left alone long enough. The nail shape was the beginning of that conversation. A curve in a fingernail that led, eventually, to a colonoscopy that found something worth finding. Your nails remember what your body has been through. The shape they grow into tells part of that story. Now, let me come back to color, but a different color than we discussed at the beginning. Look at your nails again. This time, look specifically for a yellow tint. Not bright yellow, a dull, thickened, slow-growing nail with a yellowish color and possibly a slightly detached edge. Nails that have become noticeably thicker than they used to be, that don't grow as quickly as they once did, that seem almost inert. The most common cause of yellow, thickened nails after 60 is a fungal infection, onychomycosis, and I mention it not because it's dramatic, but because of what happens when it goes untreated for years, which it frequently does because people are embarrassed by the appearance and assume nothing can be done. Fungal nail infections don't stay in the nail. The fungal organisms responsible exist in the skin around the nail, in the nail bed, in the space between the toe and the shoe. They can spread to other nails. They create microbreaks in the skin barrier at the nail margins that serve as entry points for bacterial infections. A particular concern for anyone with diabetes or reduced peripheral circulation, where a skin break in the foot can become something serious very quickly. But here's the part people genuinely don't know. Not all yellow nails are fungal. There is a rare but real condition called yellow nail syndrome in which nails become yellow, slow-growing and thickened not because of infection, but because of lymphatic dysfunction. The lymphatic system, the body's secondary circulatory network that manages fluid and immune activity, when it's not draining properly, can produce changes visible in the nails. Yellow nail syndrome is associated with chronic respiratory conditions, lymphedema, and in some cases with pleural effusion, fluid accumulation around the lungs. A yellow nail that doesn't respond to antifungal treatment after a reasonable trial, particularly if accompanied by any leg swelling or respiratory symptoms, deserves a different kind of evaluation than a simple fungal nail. I raise this not to create alarm over a common cosmetic complaint. I raise it because the difference between a treatable fungal nail and an untreated systemic condition sometimes comes down to whether someone asked the follow-up question. Let me bring this together now in a way that's practical rather than simply informative. You've just done more nail examination in the last several minutes than most people do in a year. And what I want you to walk away with is not anxiety, but a framework, a set of things to look for, periodically and deliberately, that takes about 2 minutes and requires nothing except natural light and your own hands. The dark line that wasn't there before, the clubbed fingertip with no diamond gap, the spoon-shaped nail that curves inward, the yellow, thickened nail that won't grow. These are 4 different signals from 4 different systems, and they are all accessible to you right now, without an appointment, without a blood test, without anything except the willingness to look. When you find something, document it. A photograph in your phone, dated, is more useful to a doctor than a description. My nail looks different is hard to evaluate. A photograph from 3 months ago next to one taken today is evidence. When you bring it to a doctor, be specific. Don't say, "My nails look a little odd." Say, "I want to show you something I noticed on this nail specifically. It's changed in the last 3 months. I want to understand what it might mean." That specificity determines the quality of the response you get, and check periodically. Not obsessively, but perhaps once a month, in good light, as part of the same routine awareness you might bring to your blood pressure or your weight. Something I've come to believe, after years of this work, is that the most powerful diagnostic tool in preventive medicine isn't an MRI machine or a genetic test or any piece of technology. It's an informed person who knows what to look for on their own body and is willing to ask about it. Raymond's daughter looked at his thumb. Harriet's nail shape started a conversation. Gerald's cold hands led to a cardiologist. None of these things required special equipment or special training. They required attention, and the willingness to treat a small visible change as information rather than noise. You now have that information. Use it. Tell me in the comments. Did you check? What did you find? Did any of the signs I described look familiar? Did the dark line section make you look twice? I genuinely want to know what you noticed, and I want others watching to know what their nails might be showing them. There's a follow-up video I'd point you toward about what the whites of the eyes and the color of the tongue reveal in people over 60. Same principle, different surfaces, and a couple of findings in that one that are even more surprising than what we covered today. Take care of your whole body, including the parts you see every day but rarely truly look at. Your hands have been trying to tell you something. Today, for the first time, you know how to listen.